Good day. The Men's Health Committee of the CSID and the Section of Urology of our institution is proud to bring you a series of activities in line with the topic of men's health awareness this June in the celebration of Father's Day. First and foremost, in line is the National Digital Rectal Examination Program, dubbed as Tayo Naman 2022, in partnership with the Philippine Urological Association. This will be held at our outpatient department on June 11 from 8 to 12 noon. Limited slots are available. Kindly sign up early. The second would be a lay forum via Facebook Live, which will be held on June 23 at 5 to 6 p.m., which will tackle on issues on men's health. The third and final part of the program is a lecture series on prostate health awareness. The first part I will be discussing today is on diagnosis and treatment, and part 2 would be discussed by my colleague on the surgical options once medical therapy fails. Now let's talk about the prostate gland. It is a walnut shape, or what we call as a siniguelas in size, and it is surrounded by the urinary bladder and the urethra. So once the prostate tends to grow big with age, it tends to compress the urethra, thereby causing lower urinary tract symptoms. Focused urologic exam entails detailed history and accomplishing the symptom score known as the IPSS, or the International Prostate Symptom Score, which is available in English and in Tagalog version, as well as basic laboratory exam and a focused digital rectal examination. The lower urinary tract symptoms comprises of 7 bothersome symptoms, which utilizes the mnemonics of FUN-WISE. FUN for the irritative symptoms, namely your frequency, urgency, and nocturia, while for your obstructive symptoms, your weak stream, intermittency, straining, and incomplete emptying of the bladder. Basic laboratory exam entails a urinalysis to check for the presence of urinary tract infection, and serum creatinine if the prostate is already causing renal damage. Ultrasound is likewise vital in determining the size of the prostate, presence of bladder stones, and residual urine volume. A digital rectal examination is very important to check for the consistency, the feel, for any induration of the prostate, as well as for nodules, and to determine the size of the prostate gland. There are 2 basic categories of medication. The first are the alpha blocker, which relaxes the smooth muscle sphincter of the urethra, thereby facilitating good flow of urine. The second are the 5-alpha reductase inhibitors, which blocks the conversion of testosterone to dihydrotestosterone, thereby inhibiting the size of the prostate gland. These are not without complications. Your alpha blockers can cause retrograde ejaculation, while your 5-alpha reductase inhibitors can cause decrease in libido. This should be fully explained to our patients. Patients are required to come back after 4 to 6 weeks for re-evaluation if there is some improvement in the symptom score. If there is no improvement, surgical options should be discussed to the patient.
The prostate gland is a walnut-shaped gland situated between the bladder and the penis. Para siyang siniguelas sa pagitan ng pantog tsaka ng ari. So siya yung nasa gitna. So pag ihihi ka, dadaan siya dun sa prostate bago lumabas. Okay, so pag lumalaki ang prostate, bumabara ang daloy ng ihi palabas. Ano naman ang mararamdaman mo kung bumabara? Okay, isa-isayin natin yan. Merong weak stream. Ano yun? Mahina ang daloy ng ihi. Dati, palayuan ng ihi. Ngayon, hindi na. Pumapatak, malapit na eh. Next, intermittency. Yung paglabas ng ihi mo, parang patak-patak na lang. Imbis na isang magandang flow. Nocturia, ilang beses ka kailangan gumising sa gabi para umihi. Napuputol ang panaginip dahil sa pag-ihi. Straining, yung pag-iihi ka, kailangan ka pang umiri para lang lumabas. Urgency, alam mo yung iihi ka tapos nagmamadali ka kasi kung hindi, mababasa na ang brief mo. Residual urine, pagkatapos mo umihi, parang may natitira. At frequency, ano yun? Kada oras, kada 30 minutes, ihi ka ng ihi? Meron ka ba niyan? Kung meron ka niyan, baka nga malaki na ang prostate mo. Pag malaki kasi ang prostate, kailangan natin asikasuhin yan. Malay natin, baka cancer yan. Sa babae nga may breast cancer. Ang lalaki, prostate cancer. And as urologists, yan ang aming iimbestigahan. Pag hindi naman cancer, pwede naman namin yung gamutin or operahan. Pwedeng operahan ng walang hiwa. Yun ang tinatawag na TURP or transurethral resection of the prostate. Sa pamamagitan ng isang telescope, dadaan yung telescope sa daanan ng ihi mo at kakayurin yung nakabara na prostate para gumanda uli ang daloy ng ihi mo. Ang maganda dito sa Chinese jet, meron din yung makabagong laser, yung tinatawag na thulium laser of the prostate. Ang maganda doon, konti lang ang pagdugo, madalang nasasalina ng pasyente ng dugo, at sandali lang sila sa ospital, 1-2 araw lang. Ang maganda po, sana magpasuri na tayo para malaman dito sa Chinese General Hospital at sa ating mga urologists dito para malaman natin kung anong magandang magawa para sa inyong prostate.